All right, 7:13. Now that more and more people are getting booster shots and more kids are getting shots, it's another good time for You Ask, We Answer. And we're joined once again by Trinity Health of New England's Dr. Syed Hussain. Good morning, doctor. How are you today?
Morning. I'm great, thank you.
And glad to have you here. Of course, we're expecting updated guidance from the federal government regarding booster shots for adults who should and should not get it. Governor Ned Lamont, as you know, has not waited, nor has Governor Charlie Baker up in Massachusetts. They're saying all adults should go out and get them. Whose advice should we follow? Because for right now, it's a little conflicted.
Honestly, if you look at the data, it makes sense for everyone that's 6 months out now if you receive Pfizer or Moderna to get a booster. That's the bottom line. So if you fall in that category, please make an appointment to get your booster. As we head into winter season, it's important that you get boosted in terms of your COVID-19 immunity. If you're 2 months out from your Johnson & Johnson vaccine dose, then you are also eligible, and mixing of vaccines is also now allowed. So just to make it simple for folks, if you're in one of those timeframes, please get a booster.
There was something Governor Lamont said, I believe 2 days ago, that caught my ear, because maybe he misspoke, but maybe not. He had said that if you're 6 months out from your last booster shot, to get another booster shot. And that's the first time I'd heard any government official, FDA, CDC, anybody talking about the possibility of a second booster shot. He may have just been misspeaking, but nevertheless, it raises a good question. Do we have any sense at this point whether one booster shot may cover people for a longer period of time? Does it look like maybe we're going to just need to get them like the flu shot on a yearly basis or semi-annually?
So it's hard to say, Tim. It's still early. I mean, we still have to get through this booster phase. We have to look at data. We have to see how the virus is behaving, how immunity is standing up. Are we seeing breakthrough infections after boosters have been administered 6 months and beyond? So it's hard to say. It's too early. Now, there is a category, very small subset. If you're immunocompromised, per CDC definition, and you were eligible for a third dose, those individuals may be eligible for a booster. So that's a very small subset, though. But by and large, if you're done with the 2 vaccination series, you are eligible for a booster shot if it's 6 months and beyond.
Also, doctor, I know we always like to talk about the effectiveness of the vaccines and the booster shots in terms of can they prevent symptomatic illness. But there's also other measuring sticks. How about severe illness, hospitalizations? How about deaths? Where do we stand without booster shots? Just getting the 2-shot series of Moderna and Pfizer, or the 1-shot Johnson & Johnson. Do we know how well those are protecting against very severe cases of COVID without a booster shot?
Yeah, so there's waning immunity. And we've seen real world data coming out from Israel, for instance, where they compared 700,000 people who were boosted compared to a cohort that only received 2 shots of the Pfizer vaccine. And there were more severe outcomes in the second group, which did not receive a booster. So we don't want to go there. We don't want to lose a single person, because we have very safe and effective vaccines in our midst. It's important that everybody, as we head into this winter season and the holiday season in particular, especially because of gatherings and mingling, that you get the booster shot.
All right, so where does that leave us now, given Connecticut's vaccination rate and booster shot rate for Thanksgiving? What are some of the best practices here? I mean, people, they just seem like they're starting to get sick of mask wearing, especially indoors and in family settings.
So the 3 important things I want folks to remember. First and foremost, in your gathering, is everybody vaccinated and up to date with their booster? If the answer is yes, that's fantastic. That's the safest environment you can provide. If the answer is no, if there are unvaccinated individuals in a gathering, second question you need to ask is, are there any vulnerable people? Are there people with immunocompromised conditions or an underlying medical condition that will put them at higher risk for developing severe COVID-19? Are there any children below the age of 5 that are not yet eligible to get the vaccine? Third, what is the community transmission risk? If the answer to this is mixed gathering, unvaccinated individuals, high community transmission of COVID-19, please reconsider from attending. And if you must attend, then public health measures are extremely important. That includes masking, distancing, and also insist on the unvaccinated individuals getting a rapid test, for instance. Those tests are now available in pharmacies.
They are, yes, and they're not terribly hard to find. All right, Dr. Syed Hussain, thank you once again for trying to make sense of what is always very complicated given everybody's different statuses and how community transmission rates change over time. It's not easy to try to simplify down, but you do a good job for us. Thank you so much.